New at 6, Arkansas's next legislative session is about a month away, and lawmakers are already filing bills. With almost all abortions banned in Arkansas after the overturning of Roe v. Wade, one local representative is now focused on maternal health care. 5 News reporter Catherine Gilker breaks down his proposed legislation.
Representative Aaron Pilkington represents District 45, which includes all of Johnson County and part of Pope County. Pilkington says he was focused on improving health outcomes before the state's trigger law went into effect, banning abortions except to save a mother's life. Now he says it's even more important.
We're expecting, around 3,000 more births than last year because of this. And so I think we need to have resources available. We say we're pro-life. We need to put our money where our mouth is.
Pilkington has filed 3 bills aimed at helping moms. One would require companies that offer to send women out of state to get an abortion to also provide 16 weeks of paid maternity leave. Right now, Arkansas does not require paid maternity leave, just unpaid FMLA, which protects the jobs of certain employees.
If they support a woman's choice, they should support her choice if she chooses to keep that baby. And I've gotten a lot of good reception on the right and the left about this. Obviously, we would be the first state with an abortion ban that also had a paid family leave bill on the books.
Another bill filed by Pilkington aims to require Medicaid coverage for mothers for 1 year after giving birth. Right now, Arkansas is one of just a few states that doesn't extend Medicaid out a full year after birth, only 60 days. A lack of coverage, he believes, leads to bad health outcomes.
I think what we'll see is a lot of women will be able to get the resources they need, get paid for. And once again, this is something that I think is ultimately going to save us money because we're going to reduce the amount of ER visits, reduce the amount of infant and mother mortality.
Laura Kellums is a Northwest Arkansas director for Arkansas Advocates for Children and Families. She says almost half of women who give birth in Arkansas each year are insured under Medicaid. And the state has some of the highest maternity mortality rates in the nation.
Really want to make a difference in the lives of new mothers. What we can do is ensure that they have the medical care, quality medical care that they need in those months following delivery. And all the way through that first year. And that's when we really need to make sure that their needs are being met.
Covering news where you live, Catherine Gilker, 5 News.